Imagine taking a pill every day because your doctor said it would protect you, only to discover years later that it may be quietly damaging your heart. A senior cardiac surgeon recently spoke out about a drug millions of older adults use, and what he revealed is shocking, unsettling, and something every person over 60 needs to hear. For decades, older adults have trusted prescriptions as a lifeline. A small tablet in the morning, another at night, and the promise of safety, stability, and longer life. But here's the uncomfortable truth many doctors don't have time to explain in a short appointment. Not every drug that helps in our 40s or 50s is still helping you in your 60s, 70s, or beyond. In fact, some medications can slowly work against the aging heart without causing obvious warning signs until real damage has already begun. This warning didn't come from a social media influencer or a wellness blog. It came from a cardiac surgeon who has spent over 30 years inside operating rooms, literally holding human hearts in his hands. After performing thousands of bypass surgeries and heart repairs on older patients, he began noticing a troubling pattern. Many of the patients on his operating table shared one common factor: a specific medication that was supposed to be heart protective. At first, he ignored the coincidence. Surgeons are trained to focus on anatomy, not prescriptions. But year after year, case after case, he kept seeing the same thing: stiffened heart muscle, weakened pumping ability, accelerated plaque instability. And when he reviewed patient histories more closely, that same drug appeared again and again, especially in adults over 60. Here's what makes this so important. Aging changes the heart. The heart muscle becomes slightly stiffer. Electrical signals slow down. Blood vessels lose elasticity. This is normal. But certain medications interact with these age-related changes in ways that medical textbooks don't always emphasize. What was once helpful can become harmful when the body's chemistry changes. The surgeon explained that the issue is not that the drug is evil or useless. It's that it was never designed with older hearts in mind. Clinical trials often focus on middle-aged adults, not seniors with multiple conditions, slower metabolism, and more fragile cardiovascular systems. So when older adults stay on the same medication for 10, 15, or even 20 years, problems can quietly build. One of the most dangerous aspects is that the damage doesn't happen overnight. There's no dramatic chest pain at first, no sudden collapse. Instead, the heart slowly adapts in unhealthy ways. The muscle may weaken just enough that fatigue feels normal. Shortness of breath is blamed on aging. Lightheadedness gets dismissed as dehydration. Meanwhile, the heart is working harder and less efficiently every single day. The surgeon described how many of his patients were shocked when they finally learned this. They did everything right. They followed medical advice. They took their medication faithfully, and yet they still ended up needing major heart surgery. Some even asked him, "Doctor, did I do something wrong?" His answer was always the same: no, you trusted the system. And this is where the warning becomes urgent. According to this surgeon, one commonly prescribed drug can interfere with how the heart muscle uses calcium, a mineral absolutely essential for strong, coordinated heartbeats. In younger bodies, the heart compensates. In older adults, that compensation weakens year by year. The result? Reduced pumping strength, increased rhythm disturbances, and higher risk of heart failure. What's worse is that routine checkups often don't catch this early. Standard blood tests may look fine. Blood pressure might appear controlled. Cholesterol numbers may even improve. But deep inside the heart muscle, subtle damage continues. By the time symptoms become undeniable, intervention is far more difficult. The surgeon emphasized something critical. Many doctors are not intentionally hiding this information. They are following established guidelines. But guidelines evolve slowly, and real-world surgical experience often reveals truths years before they make it into official recommendations. Surgeons see outcomes. They see patterns. And when a surgeon of this level speaks up, it's worth listening. Now, before panic sets in, understand this clearly. You should never stop a medication suddenly or without medical guidance. That can be dangerous. This message is not about fear. It's about awareness. It's about asking better questions and understanding that one-size-fits-all medicine doesn't work well for aging hearts. The most heartbreaking part, according to the surgeon, is that many of these heart issues could have been reduced or even avoided with timely medication review, dosage adjustments, or safer alternatives more suitable for older adults. But because seniors are often told, "You've been on this for years, so it's fine," the opportunity is missed. And here's something most people don't realize. The heart you have at 70 is not the heart you had at 50. Treating it the same way is like putting old engine oil into a brand new car, or worse, using racing fuel in an engine designed for steady cruising. It might run for a while, but damage is inevitable. In the next part, I'll reveal exactly what type of drug this cardiac surgeon is warning about, why it's so commonly prescribed to seniors, and the specific signs that may indicate your heart is being affected, signs most people overlook or misunderstand. The drug this cardiac surgeon is warning about falls into a category that many seniors recognize immediately. It's often prescribed to control blood pressure, protect the heart after a cardiac event, or reduce strain on the cardiovascular system. In fact, millions of older adults are told this medication is essential for keeping their heart safe. The irony is painful because in aging hearts, the very mechanism that makes this drug effective can slowly become a liability. This medication works by altering how the heart responds to stress hormones and how strongly it contracts with each beat. When you're younger, this can be helpful. It reduces excessive workload on the heart and prevents overexertion. But as the surgeon explains, the older heart doesn't respond the same way. Muscle fibers are less flexible. Electrical signaling is slower. Blood flow through tiny coronary vessels isn't as robust. When this drug continues to blunt heart function year after year, the heart may lose the strength it needs to adapt. What shocked the surgeon most wasn't just the number of patients taking it, it was how long they'd been taking it. 10 years. 15 years. Sometimes longer. No one had ever reassessed whether the drug still made sense for their aging physiology. It had simply become part of the routine. Refill after refill, visit after visit. Everything looks stable, they were told. But inside the operating room, stability was an illusion. The surgeon noticed hearts that struggled to rebound after being temporarily stopped during surgery. Recovery times were longer. The heart muscle appeared more sluggish, less responsive. In patients not taking this medication, the heart often bounced back faster. Over time, the pattern became impossible to ignore. Here's where the science comes in. As we age, our bodies process medications more slowly. The liver clears drugs less efficiently. The kidneys excrete them at a reduced rate. That means the same dose you tolerated at 55 may act much stronger at 70, even if the prescription hasn't changed. The surgeon believes this leads to a quiet accumulation effect, where the heart is exposed to a higher functional dose than intended. Another concern involves exercise tolerance. Many seniors on this medication report feeling tired more easily, getting winded during simple activities, or losing motivation to stay active. Often, they assume this is just aging. But the surgeon explains that reduced physical activity accelerates heart decline. The heart is a muscle. When it's understimulated for years, it weakens. This drug may unintentionally contribute to that cycle by limiting the heart's ability to respond to movement. Even more troubling is how this medication can mask warning signs. Because it suppresses heart rate and blunts adrenaline response, seniors may not feel typical symptoms when something is wrong. A developing rhythm problem, reduced blood flow, or early heart failure might not produce strong signals. The body whispers instead of shouting, and whispers are easy to miss. The surgeon shared a case that stayed with him. A 72-year-old man who had been on this drug for nearly 2 decades. No chest pain, no dramatic symptoms, just increasing fatigue and occasional dizziness. His primary checkups were normal. Then one morning, he collapsed. Emergency surgery revealed severe weakening of the heart muscle. The damage hadn't happened suddenly. It had been building quietly for years. What makes this especially dangerous for older adults is that symptoms are often attributed to unrelated issues. Fatigue becomes low energy. Shortness of breath becomes being out of shape. Brain fog becomes senior moments. Meanwhile, the heart is struggling to pump effectively with each passing month. The surgeon stresses that this doesn't happen to everyone, but it happens often enough to raise serious concern. He's not calling for panic or mass discontinuation. He's calling for individualized care. He believes seniors should have their medications reviewed, not just for blood pressure or heart rate numbers, but for overall heart performance, exercise tolerance, and quality of life. He also points out a major communication gap. Cardiologists may focus on preventing acute events like heart attacks. Surgeons, on the other hand, see the long-term structural consequences. When those two perspectives don't fully overlap, patients fall into the middle, especially older adults whose needs change more rapidly. One of the most powerful statements the surgeon made was this: "We're very good at keeping people alive longer. We're not always good at keeping their hearts strong longer. That difference matters." Longevity without strength leads to dependence fatigue and declining independence, things most seniors fear more than almost anything else. In the next part, I'll explain the early warning signs older adults should never ignore, how to talk to your doctor without sounding confrontational, and what safer adjustments may look like for aging hearts without stopping treatment abruptly. One of the most important things the cardiac surgeon emphasized is that the heart almost always sends signals before serious damage occurs. The problem is that older adults are often taught to ignore those signals or explain them away. The signs are subtle, gradual, and easy to dismiss, but they matter. One early warning sign is a noticeable drop in stamina. Not dramatic exhaustion, but a quiet change. Activities that once felt easy, walking up a short flight of stairs, carrying groceries, gardening for 20 minutes, start to feel heavier. You may need more breaks. You may feel unusually tired afterward. The surgeon explained that this is often one of the first clues that the heart's pumping strength is being suppressed too much. Another overlooked sign is feeling flat during movement. Seniors often describe it as moving without energy or enthusiasm, even when motivation is there. This can be a direct result of the heart being prevented from increasing output when the body demands it. Over time, this discourages physical activity, and the heart weakens further from lack of challenge. Lightheadedness or brief dizziness, especially when standing up or walking, is another signal that deserves attention. Many older adults blame dehydration or low blood sugar, but the surgeon warns that this can indicate reduced blood flow to the brain caused by an underperforming heart. When this happens regularly, it increases fall risk, a major threat to senior independence. Shortness of breath during mild exertion is another red flag. Not gasping, but a feeling that you can't quite catch your breath, doing things you used to do comfortably. The heart and lungs work as a team. When the heart can't push blood efficiently, oxygen delivery suffers. Over time, this becomes more noticeable, even if scans and routine tests look acceptable. There's also something many people don't associate with heart health at all: cold hands and feet. The surgeon explained that reduced cardiac output often shows up in the extremities first. When the heart is weakened, the body prioritizes vital organs and reduces circulation to hands and feet. Seniors may chalk this up to circulation issues without realizing the heart may be involved. Perhaps the most dangerous sign is the absence of obvious symptoms. The surgeon repeatedly warned that silence doesn't equal safety. Some of the most severe cases he treated involved patients who felt mostly fine until a sudden event occurred. This is why waiting for chest pain is a mistake, especially in older adults whose symptoms often present differently. So what should seniors do with this information? The surgeon's advice is surprisingly simple, yet rarely followed. Have a medication review specifically focused on aging, not just disease management. Instead of asking, "Is this controlling my numbers?" ask, "Is this still the best option for my age and activity level?" He encourages seniors to talk openly with their doctors without fear or confrontation. You're not questioning your doctor's expertise, you're updating the context. A helpful way to begin the conversation is by saying, "I've been feeling more tired and less active lately. Could my medication be playing a role?" This opens the door without accusation. Another powerful question is, has my dosage been reviewed since I turned 60 or 65? Many prescriptions are started earlier in life and simply continued indefinitely. But aging changes how drugs behave in the body. A dose that was once appropriate may now be more suppressive than necessary. The surgeon also advises seniors to request functional evaluations, not just lab results. Ask about exercise tolerance, heart rate response to movement, and overall cardiac performance, not just blood pressure readings taken while sitting still. The heart's real job is to respond to life, not just perform well at rest. Importantly, the surgeon warns strongly against stopping any heart medication suddenly. That can be extremely dangerous. Abrupt withdrawal can trigger rebound effects, spikes in blood pressure, or rhythm disturbances. Any changes must be gradual and supervised. Awareness leads to safer adjustments, not impulsive decisions. In many cases, the solution isn't stopping the medication entirely. It may involve lowering the dose, switching to a more age-appropriate alternative, or balancing it with lifestyle interventions that strengthen the heart naturally, such as gentle resistance exercise, walking, and breathing techniques. The surgeon believes the future of senior heart care must shift from aggressive suppression to intelligent support. Instead of forcing the heart to work less at all times, the goal should be helping it work well when needed and recover efficiently afterward. In the next part, I'll explain what many cardiac surgeons now believe is a safer long-term strategy for protecting aging hearts, how lifestyle and medication should work together, and why movement, done correctly, can be more powerful than another prescription. The cardiac surgeon believes that protecting an aging heart requires a shift in mindset, both from doctors and from seniors themselves. For decades, the dominant approach has been to slow the heart down, reduce its workload, and keep it as quiet as possible. That strategy can be life-saving in certain situations, but when applied too broadly and for too long, it may unintentionally weaken the very organ it's meant to protect. He explains it this way: the heart is not a fragile ornament meant to sit still. It's a living muscle designed to adapt, respond, and recover. When it's constantly suppressed, never allowed to rise, never challenged gently, it begins to lose resilience. And resilience, more than anything else, determines how well a heart ages. This is why many surgeons are now paying close attention to how seniors live day to day, not just what medications they take. A heart that can safely increase its output during movement and then settle back into rest is far healthier than a heart that stays artificially slowed all the time. The surgeon stresses that appropriate movement is not dangerous for older hearts, it's necessary. One of the most powerful tools he recommends is controlled, low-impact physical activity that encourages natural heart responsiveness. Simple walking, light strength training, and balance-focused movements send a message to the heart: stay engaged. When done consistently, these activities can improve circulation, oxygen delivery, and even how efficiently the heart muscle contracts. The problem arises when medication prevents the heart from responding to these activities. Seniors may feel discouraged because movement feels harder than it should. Over time, they move less, sit more, and the cycle accelerates. The surgeon has seen patients regain surprising amounts of function once their treatment plan was adjusted to support, not suppress, their heart during daily life. He also talks about breathing, something almost no one associates with heart strength. Slow, deep breathing activates the parasympathetic nervous system, reducing harmful stress while still allowing healthy heart variability. This balance, calm at rest, responsive during activity, is what aging hearts need most. Another critical point the surgeon raises is that many seniors are over-medicated not because of negligence, but because of fragmentation. One doctor prescribes something for blood pressure. Another adds a medication for rhythm. Another focuses on cholesterol. Each drug makes sense on its own, but together they can overly blunt heart function, especially in older bodies. This is why he strongly supports periodic prescribing evaluations for seniors, not removing everything but reassessing what is truly necessary now. Studies increasingly show that simplifying medication regimens in older adults can improve energy levels, balance, and even cognitive clarity without increasing cardiac risk when done carefully. Nutrition also plays a role, though the surgeon is careful not to oversell it. He emphasizes adequate protein intake to support heart muscle maintenance, proper hydration to maintain blood volume, and minerals like magnesium and potassium, when appropriate, to support electrical stability. These don't replace medication, but they help the heart respond better to both stress and rest. One of the most telling things the surgeon said was this: "I can often tell how someone has lived by the way their heart looks." Hearts that have been gently challenged tend to be more adaptable. Hearts that have been overly protected often appear weaker, less responsive, and more dependent. He wants seniors to understand that protecting the heart doesn't mean treating it like it's always in danger. It means respecting its need to function. Medication should act like guardrails, not chains. It should prevent extremes, not eliminate natural response. In the next part, I'll share what the surgeon advises seniors to do right now, practical steps you can take before your next doctor visit, how to prepare for a medication review, and how to advocate for your heart without fear or confusion. The surgeon's advice for seniors begins with preparation, not confrontation. He believes the most effective changes happen when older adults arrive at their appointments informed, calm, and specific. Instead of focusing on fear, he encourages focusing on function, how you feel, how you move, how your daily life has changed over the years. Before your next doctor visit, he suggests taking a simple inventory. Write down how your energy levels compare to 5 years ago. Note whether you feel steady on your feet. Pay attention to how quickly you recover after walking or light activity. These real-life experiences often reveal more than a snapshot blood pressure reading taken while sitting still. He also encourages seniors to bring one clear question to the appointment: is my current heart medication still supporting my strength and independence at my age? This reframes the conversation. It shifts the goal from pure risk prevention to quality of life and long-term resilience, something many doctors welcome but don't always have time to explore unless prompted. Another important step is asking whether your medication has been evaluated in combination with everything else you take. Many heart-related side effects are not caused by a single drug, but by the cumulative effect of several medications working in the same direction. Simplifying even slightly can reduce strain on the heart and nervous system. The surgeon also advises seniors to request periodic reassessment after major life changes. Retirement, weight loss, reduced stress, increased activity, or recovery from illness can all change how your body responds to medication. What was necessary during a stressful or unstable period may no longer be needed at the same level years later. One thing he repeatedly stresses is that fear should never guide heart decisions. The goal is not to abandon medical care but to refine it. Modern medicine is incredibly powerful, but power must be applied with precision, especially in aging bodies. Adjustments made thoughtfully can improve both safety and vitality. He shares that some of his most rewarding moments come years after surgery, when former patients return stronger than expected, not because of aggressive treatment, but because their care was personalized. Their medications were adjusted, their movement encouraged, their hearts allowed to participate in life again. The underlying message of the surgeon's warning is not about one drug alone. It's about awareness, about recognizing that aging changes everything: how we heal, how we respond, how we adapt. Medications that once protected may need reevaluation to continue serving us, not silently working against us. For older adults, the heart is more than a pump. It's the engine of independence. It determines how long you can walk, how confidently you move, how fully you engage with the people you love. Protecting it means more than lowering numbers on a chart. It means preserving function, strength, and confidence for as long as possible. The surgeon's final message is one of empowerment. Seniors are not fragile, they are experienced. And with the right information, they can partner with their doctors to make smarter, safer decisions for their aging hearts, decisions that support not just longer life, but better life. What many seniors don't realize is how quickly the heart can respond once it's given the right conditions. The surgeon has seen this repeatedly. Older patients who believed their fatigue, weakness, or shortness of breath was permanent began to feel subtle improvements within weeks of carefully adjusted care. Not dramatic miracles, but meaningful changes. Walking felt easier. Recovery after activity improved. Confidence slowly returned. He explains that the aging heart is not broken, it's adaptable. Even in the 70s and 80s, the heart can regain efficiency when unnecessary suppression is reduced and healthy stimulation is reintroduced. This challenges a long-standing myth that decline is inevitable and irreversible. In many cases, it's not age that limits the heart, it's how we manage it. The surgeon also addresses a common fear among seniors: the fear of change. Many older adults worry that adjusting medication could trigger a heart attack or sudden event. He understands this fear deeply, but he emphasizes that thoughtful, gradual adjustments under medical supervision are far safer than staying on an inappropriate regimen indefinitely. Risk doesn't disappear by avoiding change, it often grows quietly. Another issue he raises is how symptoms are normalized in older adults in ways they never would be in younger patients. If a 45-year-old suddenly lost stamina, doctors would investigate aggressively. If a 75-year-old experiences the same change, it's often labeled normal aging. The surgeon believes this mindset has caused countless seniors to live with preventable limitations. He urges families to pay attention to. Adult children and caregivers often notice changes before seniors do themselves: slower walking, more sitting, reluctance to leave the house. These are not just lifestyle shifts, they can be signs that the heart is being held back, not supported. Encouraging medical conversations can be an act of love, not interference. The surgeon also highlights how emotional health ties directly into heart function. When seniors feel weak or dependent, stress hormones rise. Chronic stress stiffens blood vessels and worsens cardiac efficiency. When seniors feel capable and active, the heart benefits chemically as well as physically. Supporting heart strength isn't just about medications, it's about restoring agency. One powerful concept he shares is cardiac confidence. Seniors who trust their bodies move more, they breathe deeper, they engage socially. This keeps the heart responsive and resilient. Overly suppressive treatment can unintentionally erode that confidence, making seniors fearful of movement and overly cautious, ironically increasing long-term risk. He also points out that many heart-related hospitalizations in older adults are not caused by sudden disease, but by gradual deconditioning. The heart slowly weakens, balance declines, falls occur, infections follow, and recovery becomes harder. Supporting heart function early can prevent this downward spiral. The surgeon's warning, at its core, is about timing. Waiting until symptoms are severe often means fewer options. Early awareness allows for gentle corrections instead of aggressive interventions. That's why he speaks so passionately about this issue, because he sees the end result when adjustments come too late. In the final part, I'll tie everything together and share the surgeon's closing message for seniors and families, what he wants every older adult to remember when it comes to protecting their heart, their independence, and their future. If there's one takeaway from this cardiac surgeon's warning, it's this: your heart is not just something to protect from danger, it's something to protect for life. Medications can save lives, but only when they evolve with the body they're meant to support. What keeps a heart safe at one stage of life may quietly hold it back at another. Aging doesn't mean your heart should grow weaker by default. Many of the limitations older adults accept as normal are often signals that something needs to be reevaluated, not endured. Fatigue, shortness of breath, and loss of confidence in movement are not simply the cost of getting older, they're messages worth listening to. This surgeon's warning isn't about rejecting modern medicine. It's about using it wisely, about asking better questions, reviewing long-term prescriptions, and making sure your treatment plan supports not just survival, but strength, independence, and dignity. Small, thoughtful adjustments made safely and under medical guidance can make a meaningful difference. Your heart has carried you through decades of work, stress, joy, and challenge. It deserves care that recognizes its experience, not just its risk factors. When seniors, families, and doctors work together, the heart isn't just protected, it's respected. So if you're someone you love is over 60, take this message seriously, but calmly. Stay curious, stay involved, and remember your heart isn't done yet. With the right balance of care and awareness, it can continue supporting a full, active life for years to come.